Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here, and we are on the island. We're on Mackinac Island. We're at the Grand Hotel for the Detroit Regional Chamber of Commerce's annual Policy Conference, and a ton of stuff comes out of here. It's just pretty amazing. And one of the guys up here who's lobbying for something, you're going to find out in a minute, is Dr. Norm Beauchamp. It's so good to have you here. How you doing?
I'm doing great. Thanks so much for
it's good to have
giving me the time.
And you're the executive vice president of what?
For health sciences at Michigan State. So I work across the two med schools, the nursing school, public health, our clinical practice at Michigan State, and I chair this new relationship, MSU plus Henry Ford Health.
You're a busy guy. How'd you have time to be here?
I'm married up.
Oh, there you go.
My wife's wonderful.
Oh, that's super. We both hit the jackpot.
Amen to
which is good. All right, so let's talk a little bit about what, with all those things going on, what's the initiative you're working on?
What I'm working on is it's referred to as an innovation district. A term familiar to you, but it's where you bring together academic institutions, industry, and community to create economic uplift. I'll give you an example. Prior to this partnership in Detroit, I brought together an innovation district. I was involved with one in Seattle and one in Grand Rapids. So in Grand Rapids, first we built a research building for health, and then we said if you're in industry and you want to innovate in health, whether it's product, process, come join our innovation park. And our goal is care closer to home. What then happened is, for example, we recruited Perigo, a $5 billion home health company that's now side by side with where we do research in health, where we do education in health, and where we do clinical practice. It creates this ecosystem that's bringing about $3.5 billion to Grand Rapids. And what brought me to Southeast Michigan was the idea of bringing an innovation district to Midtown, working side by side with Henry Ford Health, where we'd bring together their $7 billion health delivery system, right, plus Michigan State and their education, plus MSU's now nearly $1 billion in research, and create the epicenter for where if you want to find transformation in health, that's where you need to be.
You know, it's kind of amazing because I don't think people realize how pharmaceutical companies and private industry gets involved in R&D, but always has to go somewhere like a university, a research university, to get it done.
Yes, well said. And we refer to it kind of now, we've moved into this knowledge economy, where a lot of what they want is academia, where we develop really great ideas, and so that's what we do, and then they're the perfect partner to get it from the idea, from the bench, to the bedside. Right now, it takes about 15 years to go from what's a great thing for people to getting it to them. By bringing us close together, you decrease product cycle time and you increase product viability. So it is that bringing together of a group that can distribute with a group that can create.
Norm, tell me about the effect that this hurried up antidote for COVID-19, what about the effects of that on long-term development? I mean, we shortened that cycle.
Fantastic question. What you're getting at is sometimes we put a gate on what we think is possible based on what was done in the past. And so if someone had said, we're going to be able to develop a vaccine, take it to market, make sure it's safe, and globally distribute it, people would say, great, that's going to take 20 years. What we saw in COVID is you can do it in a year. So it challenged the possible. And that same mentality is what we have to now bring to all the challenges we face in health, right? I think it redefined the paradigm. Another place that did that, telemedicine. How do you get care to remote parts of the state when there's only about 10% of your doctors live in remote parts of the state? We've been trying telehealth forever. COVID said you don't have a choice, and you can't put that genie back in the bottle, thank goodness.
And by the way, let's get them high-speed internet as well.
Amen.
Because that closes them out a lot too. So your card says health services. You're actually an economic developer.
Amen to that. And what I would say, my brother, is this idea that the social determinants of health. If I want to improve health, people need jobs. They need the food security. They need a place that they can live. So I can do everything possible when they come into the doctor's office. But if they don't have jobs, if they don't make a wage, if we can't keep people in state, so all of the work we're doing is to recognize, to really improve human health, you've got to improve human opportunity, and that is economic development.
Unbelievable. You do a great job, and you know what else? You're fun. You are.
You're fun.
Thanks for being
Thanks
here.
for having me.
My pleasure. Well, thanks so much for being with us. We appreciate it. Dr. Norm Beauchamp with MSU, Vice President of Health Services. We're going to be right back with a whole lot more. We are on Mackinac Island at the Detroit Regional Chamber of Commerce's annual policy conference on the Michigan Business Network.